it was tough. I never thought about dying before. Like I never thought, you know, that, but like seeing those numbers, like everything kind of flashed through my head. And I said to myself, I went through so much and it wasn't, enough. I felt better than I had felt in months because, for the past few months, I had been declining. I was able to walk the dog, um, I felt I didn't, it was almost scary because I didn't feel like I was sick.
So after they formulated a plan for you, they said, okay, we're going to put you on 2 weeks of Dex. You can go home. You're going to
Right.
take Dex orally, a pill once a day.
Yeah, it was once a day.
Once a day. So you still needed to go through this hyper CVAD. Was the 7 rounds standard or had they altered it for you?
It was altered. They omitted methotrexate because that's known to cause fetal issues with the baby. So they omitted that. Also, my TKI for the Philadelphia chromosome, they wanted to put me on ponatinib, but that was known to cause, fetal defects. So they tried me on nilotinib. The hyper CVAD was it was divided into two parts, part A and part B. Part A, you got 4 drugs. I think cytarabine. You took this dexamethasone, vincristine, and doxorubicin. Usually, it would be 4 nights in the hospital because you would get the cytarabine every 12 hours. So that would be 4 nights in the hospital. The B part would just be cytarabine, but it would be a higher dose cytarabine, and I would be in the hospital for 3 days. Now, at both A and B cycles, they did they checked, to see they checked my spinal fluid. So and then I got chemo here too. So each time they had to do that, so I got chemo. And that was the hardest part.
So every cycle really is a month. Then it'd be 1 week of treatment, 3 weeks off. Then part B would be 1 week again, and then another 3 weeks off.
Yes.
And then you would do that 7 times.
Yes.
Okay.
Well, for me, I was supposed to do it 8, but because I had the baby, that's why I only did 7. I also forgot to mention I did Rituxan.
Yeah, that is one of those drugs that can cause a reaction. So usually the first time is like a slow push or a slow drip. So wow, so you did rituximab too, and was that before or after the hyper CVAD in terms of
at the same time?
At the same time, so day 1.
Yes.
But the side effects, do you know if you could talk about what they were? I know you talk about getting sick pretty quickly. What the side effects were when they hit you, and if you know which one of them was causing the side effect?
Okay. Of course, hair loss. That one, that one hit. I think I started chemo May 5th. By about May 19th, like my hair started kind of coming out. So I had my husband give me a buzz cut. And probably by June 1st, most of my hair was gone. The cytarabine, the main thing was fevers. Like I would get fevers every single cycle. Um, Fatigue. The fatigue was pretty bad, but again, I was pregnant, so I don't know how much was from, the pregnancy and how much was from cancer. I had food aversions, like I didn't have an appetite. It was tricky for me because I started losing weight, but I was pregnant. Like 1 month I lost like 20 pounds, and brain fog. The whole, when I think about that whole experience, it's almost like a fog. I couldn't remember things. I had to set alarms to take my pills. That was tough too.
You're dealing with all these things. What happened next in terms of, I mean, I saw in your timeline that you were talking about the immunotherapy that you started in March of 2021 all the way through now.
I finished active chemo in October. I had a bone marrow biopsy done in November. I was MRD negative in the clear. My Philadelphia chromosome, my BCR ABL levels were at 0. But my doctor wanted to do blood tests every month to check those levels to make sure. The first month was fine. Around Christmas, the nurse calls me and she's like, "Hi, Renata." She's like, "Your BCR ABL levels came back elevated." And it was just like, and I'm like, "What?" And she's like, "Oh, it's at 0.02." And I'm like, "Okay." But we thought it was because we lowered my ponatinib dose. We cut it in half from 30 to 15. My oncologist did not believe it was from that. She thought that it was coming back. But, I said, "Oh, can we increase the dose and maybe to go down again?" And we did that. The next month, it was 0.01. And I have a conversation with my oncologist, and she's like, "Renata, for long-term survival, this needs to be negative. If this comes back positive again, you're going to need a stem cell transplant." And that was that was really devastating to know that the treatment, that it as much as we tried, it wasn't enough. Um so, all of January and February were just stressful because I'm waiting for these test results to come back. After, 0.01 in January, February, that's the big month. Like this has to be negative. It comes back at 0.153. So it increased. And when I saw those numbers, I knew that I would be getting a stem cell transplant. It was tough. I never thought about dying before. Like I never thought, you know, but seeing those numbers, like everything kind of flashed through my head, and I said to myself, I went through so much and it wasn't, enough. But I knew there was no doubt that I'm going to get the transplant. I asked my doctor, I said, if I don't get the transplant and, let's just say, the Blincyto gets rid of it, what are my chances of, living, of, being cured? She said 0, not 50%. She was like, it would come back eventually and I wouldn't live a long life. And hearing that from her, that made, like, as soon as she said that, I thought about my son, like, I have to do it. And, the main thing was knowing that I'm going to be away from my son. But I know that, I'll be away from him, but it'll be worth it because I'll be able to be with him. So that was really hard. Um Also, just the fear of the unknown. Like I've heard horror stories about stem cell transplants, and all of this just kind of flashed through my mind. when I saw those numbers. It's been an uphill battle from February till now because I'm actually allergic to the Blincyto. So my eosinophils have been really, really high. So I've been having like asthma symptoms. I haven't been able to breathe for like weeks. But Blincyto's saving my life right now. So it's almost like a risk versus benefit kind of thing.
Can you talk through what you understand of the process? I know it's usually like a very intensive chemo,
Yeah.
and then you undergo the transplant.
Right. I'm going to go through intensive chemo and also full body radiation. That I think I'll get for 4 days, I believe. And then the chemo, I think, is for like 3 days. And then after that, I'm going to get the cell. Like they're going to that's going to completely wipe out my immune system. Then after that, I'm going to get the cells from my brother and hope that, that I don't run into any graft versus host disease. I believe my brother's actually a half match, but so I believe I'm going to have chemo after, like a few days after the transplant too. But the doctors, my transplant specialist, but she did tell me, I do know that statistically 30% of the transplant patients don't make it through the first year. But, reading literature, I found that most of those people are older people with pre-existing conditions, which is why before you get the transplant, you have to get so many tests to make sure that you're fit for it. And, we automatically assume because I'm relatively young that, I'm fit for it. No. We first did, they did an echocardiogram of my heart, and they found that my ejection fraction had dropped from 65% to 45% within the year. I saw a cardiologist. He said he didn't think it was from chemo. He thinks it was from the pregnancy. So that meant that I had to get, more tests done on my heart. Then you have to go and do a pulmonary test. I failed that. And that's because I'm on Blincyto and I'm allergic to the Blincyto. So it's hard for me to breathe because I was actually supposed to get this transplant this month. I was supposed to get it June 13th, but because of the heart issue and the lung issue, everything has gotten pushed because, and that actually scared me because I'm like, oh my gosh, I know I need this transplant. What's going on? But right now last week they did another echocardiogram of my heart, and the ejection fraction is back up to 62%. So and then Thursday I have my pulmonary function test again. So hopefully I'll pass that. But that's what I mean. They're very thorough, and even though like I hate, like I want to get this over, I'm glad that they are so thorough because, a stem cell transplant, it's almost like a factory reset of your body. And my doctor did say there's a 70 to 85% chance that to cure it. So I think that those are good numbers, compared to me not getting the transplant. So, in that aspect, I feel blessed. I want to get it done and over with so I can move on.
Is there anything that, you want to add in terms of just guidance to other people, other ALL patients, their care partners, their family and friends?
It's you have to be positive. I mean, that's the main thing. People say to me all the time, like, oh, if I were you, I would be depressed. And I'm like, why would I be depressed? Because that's not going to fix this cancer. It's not. There are a lot of things that knock you down, like, the side effects, and sometimes you want to quit. But when you feel that urge to quit, whatever, I don't know if it's your dog, your kid, your spouse, you have to have something to hold on to something to look forward to in the future. That kind of got me through.